Good afternoon, everyone. We're going to get started. My name is Deborah Gonzalez. I'm the Government Affairs Director here at PPIC, the Public Policy Institute of California, and we want to thank you for coming here on this beautiful fall day in Sacramento. For those of you not familiar with PPIC, we're a nonpartisan nonprofit with offices both in Sacramento and San Francisco. We have some new folks here we were introducing ourselves to this morning, and of course, we told them the Sacramento office is the best office, but that's just us being competitive. And for the program today, we're going to first hear from researcher Tess Thorman, who will share some of the latest data from the California Poverty Measure, also called the CPM. It's a joint effort between PPIC and the Stanford Center on Poverty and Inequality, which provides a comprehensive look at economic hardship by accounting for earnings, cost of living, and access to safety net resources. You can learn more about the CPM on our Poverty in California page at ppic.org. And in the back of the room, there are some copies of a recent Just the Facts sheet on poverty, child poverty, and the working poor in California. We'd like to thank the Wellness Foundation and the James Irvine Foundation for their support of PPIC's work and for the work on the poverty measure. And following Tess's presentation, CalMatters' Jackie Botts will moderate a discussion with a fantastic panel. And finally, we shall have plenty of time for questions and answers. You should have received an agenda at registration, and all of the bios are on the backside. So in interest of time, we won't be doing extensive introduction today. They're a very illustrious crowd, so we felt that was the fastest way to do this. Please note we also have an online audience, and so be sure to wait for the microphone when you ask your questions. Just a few more things before we begin. We have a couple of upcoming events. The Improving Education Opportunity in California will be taking place on October 25th at the Sheraton. It doesn't have beer bread, but it's still going to be a wonderful event. So we really want to encourage you to attend that. And our annual water conference is also at the Sheraton. Preparing California's water system for climate extremes will take place on November 5th. Both events will be live webcast. More details and registration information is available at ppic.org. And later today, you'll receive a survey. We do love our surveys here at PPIC, so we hope you will answer this or any random cell phone call that you get from PPIC for our other survey that we do. And lastly, please silence your cell phones. In September, California hit a milestone. California experienced the longest economic recovery in history with 114 months of job growth. The state budget, which 10 years ago had a projected $42 billion deficit, 42, it was a tough time to be in state government, has grown to $215 billion with roughly a $20 billion reserve. Since the Great Recession, California has seen its unemployment rate drop from 12% to 4.1%. We are now clearly the fifth largest economy in the world. That was one of my favorite debates in the legislature when we would talk about that. And yet, in a state with great prosperity, we also have high levels of poverty, including deep poverty, particularly in inland California. It is not that California has not tried to address the issues before. The Poverty Task Force that was convened last year estimated the state has spent more than $21 billion on poverty-focused budget actions since 2012. I don't want to leave you with things that there is no hope. That would be terrible. The task is daunting in a state this size with a variety of issues contributing to poverty in the state. And I'm happy to report that PPIC has begun working on our 2025 strategic plan earlier this year. When we surveyed externally and internally about what we should focus on over the next 5 years, there was surprising consensus, maybe not surprising, that we needed to focus on improving opportunity for all Californians, a recognition that the recovery has been uneven at best. While this panel is convening during our 2020 strategic plan and draws on important current work from our HHS group, I believe it can help us identify issues and partners in our work we hope to do through our 2025 plan. I'd now like to introduce Tess Thorman, who is a research associate at PPIC and part of the California Poverty Measure team. Her research interests include community health, immigration, and social economic equity. She has also helped us with providing some of our really cool interactives on our webpage, if you must know, and so she's one of our favorite research associates. So please help me in welcoming Tess.
Hi, everyone. Thanks, Deborah, for the introduction, and thanks to all of you who are here today and online for joining us. We have an exciting panel coming up, and so the goal of this presentation is to set the stage for that conversation by introducing some of the highlights and trends that we find from our research using the California Poverty Measure. For those of you who are not familiar with the California Poverty Measure, or the CPM, this is a measure of poverty produced by PPIC and the Stanford Center on Poverty and Inequality that estimates whether in California families' total resources are sufficient to meet a basic, up-to-date standard of living, the cost of which varies across the state. This is a more comprehensive approach than what's used for the official poverty measure. That measure compares total income instead of resources to a threshold that varies based on family size, but not across geography. The CPM, by design, is similar to another measure you may be familiar with, the Supplemental Poverty Measure, or the SPM. That also includes total resources and cost of living, but is produced at the state level, not within the state. So here we have a snapshot of poverty in California from our latest data, which are for 2017. And we find that 17.8% of Californians, or about 6.9 million people, lack the necessary resources to meet their basic needs. To put this in context, the statewide average threshold in the CPM for a family of 4 to be in poverty is $32,500. Now, 17.8% is high. We know from the SPM that relative to other states, California has a high poverty rate, in fact, one of the highest in the country. And beyond California's high poverty rate, we know from the CPM that actually an equal number of people, another about 7 million, are out of poverty, but living just above the threshold, and that's the teal bar here. The CPM allows us to explore poverty across California's diverse populations and geographies, and we can see that some groups of Californians experience poverty at higher rates than average. Children ages 5 and under have slightly higher poverty rates. Residents of Los Angeles County have a rate of about 5 points higher than the statewide average. The poverty rate for Latino Californians and people in families where no one has a 4-year degree is even higher. It's actually about 30% higher than the statewide average. And the rate for people in families with just one adult is almost twice the statewide average. 2017 is the 7th year of CPM estimates that PPIC and the Stanford Center on Poverty and Inequality have released. And if we look at all of these years together, we can see that poverty in California is declining, but it's doing so slowly. We do actually see between 2016 and 2017 that there was a decline after 2 years with no improvement. But overall, this trend should be surprising, right? Because we see that the unemployment rate in California is at a long-term low. For all but the first year on this chart, California was adding new jobs at a higher rate than the rest of the country. In short, the economy is doing really well, but we aren't seeing a corresponding decline in the poverty rate. We are seeing an increase in inequality. There was a recent analysis from the California Budget and Policy Center showing that between 2005 and 2018, the average income for households in the bottom 10% decreased by about 5%, but for households in the top 5%, it increased by about 19%. Now, the comprehensive nature of the CPM means that it can provide some insight into some key dimensions of poverty, including the extent to which most poor families are relying on earned income and the magnitude of key work and medical expenses in the resources that they have on hand. It lets us know about the role of social safety net programs in reducing poverty in California, and it shows how many are struggling to make ends meet when we account for today's cost of living. Turning to income from work, earnings are the single largest source of resources for poor families, and this really reflects the fact that most poor non-elderly families, which is what we're looking at here, include at least one working adult. You'll also see here that the safety net plays a bigger role in family resources for families with children, but even with safety net resources, the majority of resources for those families are still coming from earnings. And this breakdown kind of varies by region, so families tend to have a higher share of their resources from earnings in high-cost parts of coastal California, where families are in poverty are less likely to be eligible for safety net programs based on higher local wages. Now, in order to be realistic about what families actually have on hand in terms of resources, we also account in the CPM for necessary expenses. So these are things like out-of-pocket medical expenses and work expenses like childcare and commuting, things that cut deeply into the resources of families in poverty but aren't included, like housing, in the poverty threshold. When we adjust this number to be for a family of 4, out of just under $30,000, the average family in poverty spends about $6,000 a year on these necessary expenses. And we find that without the expenses, poverty in California would be about 7 points lower. Now, despite families relying heavily on earnings, poverty would be much higher without the social safety net. And the CPM allows us to look at individual impacts and overall impacts of safety net programs. Overall, poverty would be 11.7 points higher absent safety net programs and 13.8 points higher for children. Without just CalFresh, poverty would be almost 2 points higher, and absent the combined earned income tax credits and the child tax credit, it would be about 2.5 points higher. Regionally, safety net programs have the biggest impacts on poverty rates in inland and northern parts of California. Now, the resources that families have on hand are growing across the board. Between 2016 and 2017, resources for families in the bottom 10% of resource holders grew by 5.8%. And to put that in context, the average amount a family in that decile has, when we put it in terms of a family of 4, is about $16,700. And on the other end, the average amount of resources for the top 20% of resource holders is about $190,000, which is more than 11 times as much. But even while there are these gains in resources for families across the board, the threshold for meeting basic needs is increasing as well. And the threshold varies largely based on housing costs. So if all counties in California had the same low housing costs as Fresno County, which is the county with costs in the lowest third of the state, we find that poverty would be 7.1 points lower. This is 2.7 million fewer people. We would have 4.1 million people in poverty in California instead of 6.9, which is the current case. In summary, California's high poverty rate really reflects opposing conditions within the state. So we have poor families relying on earnings, but with expenses weighing heavily on the resources that they have. Safety net programs are substantially reducing poverty, but the size of their impact varies across the state. And increases in resources for people in poverty are being offset by increases in cost of living. Given these realities, what can policy do to fight poverty, reduce disparities, and increase opportunity? With this question, I'd like to thank you all and to invite Jackie and our panelists up to the stage to continue the conversation. Thanks.
So thank you to Tess for so wonderfully setting the stage for this conversation today on poverty and opportunity in California. My name is Jackie Botts. I'm a reporter with CalMatters, and if you're not familiar with CalMatters, it's a nonprofit, nonpartisan newsroom dedicated to explaining California state politics and policy. I cover economic inequality, and I have a great pleasure today of introducing a very expert panel today who will help us understand what this data from the California Poverty Measure looks like and feels like on the ground in different parts of California, and will also be lending their perspectives on what policies are needed to reduce poverty in California and answer some of the questions that Tess just raised to us at the end of her presentation. So here with us today is Peter Weber, a former Fortune 500 executive and the founder of California Bridge Academies, which works in 6 counties to provide intensive training and support to help families permanently exit poverty. We have Kim Johnson, who serves as director of California's Department of Social Services, which administers many of the services that comprise what we think of as our social safety net. So that includes food and nutrition assistance, cash assistance, child welfare, housing assistance programs, and many others. We have Richard Raya, who is the director of Mission Promise Neighborhood, one of a number of Promise neighborhoods funded by the Department of Education throughout the country. It's a partnership between 20 government and community partners to support children and their families but to support children from cradle to career in San Francisco's Mission District. And we have Caroline Danielson, who is Policy Director and Senior Fellow at the Public Policy Institute of California, who has extensively researched the social safety net. Can you hear me? A little closer. Who has extensively researched the social safety net and its impact on poverty. So I encourage you all to sneak a peek at their bios on the back of your page. That was just a tiny little snippet of what they've done. But if you look at what else they've done in their careers, you'll understand what they're bringing and what they're drawing on today during this discussion. We're going to have about 40 minutes or so for discussion between the five of us, and then we're going to open it up to question and answers. So go ahead and start jotting down your questions, and if we miss anything, you'll have an opportunity to make sure that we don't by the end of the program today. And to kick it off, I'd like to start with our two experts here who are doing work that is deeply embedded in their communities to help families exit poverty. So I'd like to hear from each of you, starting with Richard and then Peter. What is the number one factor keeping people in poverty in your community?
So in our community, we are San Francisco's Mission District, a traditional Latino immigrant gateway community. We are facing a huge displacement crisis. We've lost about 8,000 Latino residents over the past 10 years. That's about a third of our population. And so for us, we are working on keeping people in place, and that means connecting them to affordable housing, as well as building up, as well as keeping them in place. So making sure they have access to their eviction rights, and then also helping them with finding jobs, building savings, building credit scores. So that's the number one issue for us is housing. And just to give you a sense of how big it is, we've helped families process more than 2,000 rent applications just in the past 2 years, and the supply is not there. So only a few hundred of those families actually get into apartments. But that's what we're doing at schools. So we work in the schools, and we meet the families there and start helping them fill out applications, in addition to a whole spectrum of other support services. But housing is clearly rising to the top right now.
Thank you. And Peter?
There are really two interconnected issues. One of them is that we have low-wage jobs in the San Joaquin Valley. About only 1/3 of the jobs in the San Joaquin Valley are considered to be high-wage jobs. Over 50% are considered to be low-wage jobs. Jobs in agriculture, in hospitality sector, and retail. That's a huge issue for us, and we got to, kind of turn that. And the second thing is very low education levels. So, where state of California has, I think it's 33%, of Californians have a BS degree in the San Joaquin Valley. That's about 20%. We have a very high proportion of people who do not have a high school degree or GED. We have a very significant immigrant population, a lot of it documented and a lot of it undocumented. A lot of the undocumented people are not eligible for some of the public assistance services that are provided. So that's kind of the combination of issues that we're facing in the San Joaquin Valley.
Thank you. And Kim, you direct the social services department that will touch the lives in one way or another of most Californians living in poverty. From your perspective, what is the top barrier to exiting poverty for those who your department touches?
Yeah, I think the two speakers before me just spoke to some of their local issues. I think those are part of them, right? Our housing costs and affordability and supply and those issues and the complexities of those. when we understand that's a foundational part of the safety net and support you need to be able to engage in any particular activity, whether it be employment, education, or otherwise. So certainly, I think there are many barriers that have just been articulated in doing that. I do think that our new governor and administration is very clear, though, and as even looking at the introductory slides where you saw what the impact would be without the safety net, right? How many more individuals or families would be in poverty without them. Some of those places where we've identified and addressed issues and have supports like food assistance in our CalFresh program or the Earned Income Tax Credit, those things are also places where the governor chose to really invest and really create additional resources to help families across the state. So I think, yes, the complexity of the issues, housing, educational, low wage employment. We also have kind of an incremental intent on the minimum wage increase that we've been working towards with the former administration too. So I think while there are still barriers, there's certainly been some progress made in moving in the right direction to address some of these issues.
Thank you. And Caroline, as someone who has studied poverty extensively, what is the top one, maybe two factors that you would point to as keeping people in poverty in California despite a booming economy?
I think I'd have to chime in and say at this point in time that, reflecting back on Tess's slides, that that housing is really a challenge that we face, and it's a long-term challenge that makes it all that more complicated, and it needs to be woven through, I think, many of the other kinds of safety net policies and approaches that we have in order to, when earnings and go up, that they're not eroded by the equal or nearly equal increase in the cost of living.
Mm-hmm. Yeah, and I think it's important you just noted that the social safety net to you includes housing, right? So as PPIC's research shows, there are some key components to California's high poverty rate. We have income from work, which has stagnated for low-wage workers, cost of living, which is on the rise across the state, and social safety net programs, and without them, our poverty rate would be much higher. I want to start to sort of pick apart the pieces of this, and let's start with the social safety net. There have been efforts in California over the past decade to expand participation and in some cases eligibility for these programs, yet in some areas participation is still low. So for example, we have relatively high participation in a program like Medi-Cal, the state's version of federal Medicaid, which is health insurance for low-income residents, enrolling about 90% of eligible people. But our participation lags in CalFresh, which is California's name for the Supplemental Nutrition Assistance Program, also known as food stamps. And we, at last count in 2016, had the 5th lowest rate of participation in the nation. So my next question is for Kim. What has worked when it comes to getting these safety net services to more people in need? And where are we still falling short? What else needs to be done?
Sure. I think there's a few different places that I think are also opportunities for further strengthening across, and those are things like ensuring that when an individual is applying for Medi-Cal, we also are offering that same and single application for CalFresh assistance or food assistance or cash assistance, right? How are we tying together the programs and resources of a very robust array that's been created in California together to make that more accessible for those in need? I think that's a big piece of that. And I think there are also some technology solutions that we're identifying in a number of ways to assist with that. So how are we looking at opportunities to both proactively outreach and communicate about the availability of resources, whether they be the CalFresh assistance or the Earned Income Tax Credit, for example, again, focused on the same populations that would be eligible for those benefits and resources. I think we also are absolutely utilizing partnerships at the local community levels. So where is the county and other government entities also partnering with community-based organizations? I think it's a particularly important thing to emphasize right now with the numerous federal immigration policies that have been coming forth and the real fear that's in community across our state. So how are we identifying when we still do have many as you mentioned, eligible populations that could be accessing some of these resources. How are we engaging with trusted messengers and community to make that outreach and that connection? There's investments in home visiting that have occurred that are also targeted, where we may be aiding and supporting a family that has a mixed status household, where the child may be a citizen, a parent may not. How are we utilizing programs like home visiting to support that family, and also our investment in, for example, immigration legal services to help with remedies to status and immigration status, which certainly changed the trajectory and pathway for our immigrant integration efforts and our population in the state. So I think there's a number of different strategies, both on partnerships, technology, but again, I think we're wanting to be intentional about who our community is, who we're reaching. 1 in 2 children in California are from immigrant households. It's a rich, robust community based on that history in California. And so we want to be thoughtful about where we're seeing a decreased uptake, or we're seeing eligible population not accessing benefits. What are those strategies where we're working together in partnership and community to make a difference?
And a quick follow-up, what could state lawmakers be doing to increase access and participation to these social safety net programs, Kim?
Yeah, I think there's a lot happening, and we're just at the end of the legislative season. I see a lot of experts in the room and people working on different policies. So I hope congratulations in many of the bills and things that have occurred. Many changes I think have occurred this session around things like looking at housing and eviction policies. I mean, there's just a lot. There's a very, very broad array of I think focused efforts, really depending on any of these solutions or programs that we're working with that have done that. There's certainly looking at, I think it was mentioned, Caroline mentioned a little bit about policies and how our policies developed in a way that address the ability for any of our participants in the safety net to continue earning more and maintain those earnings. And so things you've seen in the CalWorks, or our California's Temporary Aid to Needy Families program, CalWorks, where the asset limits have been increased, where we're seeing earned income disregard. People can essentially earn more and keep more, and also have that stability on things like childcare and assistance as they're becoming more stable to transition and exit off of aid. So I think there's been a number of solutions that both legislators and the administration have brought together forward to make some changes in these areas.
Thank you. Peter, your organization, California Bridge Academies, the model is all about helping families navigate the maze of programs, community resources, services that they might be eligible for. Can you please give us a sense of what navigating that maze actually looks like within your organization? And can this very personal approach be scaled up across the state?
Yeah, let me give you a quick sense of what the California Bridge Academies does. First of all, since we launched the California Bridge Academies in 2010, we have enrolled 4,500 clients, which is more than 12,000 people when you include family members in Bridge Academies that are now in 6 different counties. These are really poor people. They're all on CalFresh benefits. They are all either unemployed or underemployed. About 23% of them do not have a high school degree or GED. 19% of them have criminal records. Our program is an 18-month program. It's entirely voluntary. People don't have to sign up for it. They don't lose anything if they don't sign up for it. They don't have to stay enrolled for 18 months or even for a week, but they choose to. 18 months after they enroll, more than 80% are in good jobs. By the time they graduate, 18 months after first enrollment, about 30% of them are already earning enough so that they are ineligible for public assistance. About a year after first employment placement, 83% are still with their employers. And by the way, we have an ROI calculator that enables us to tell that for every taxpayer dollar we spend on the program, there's a return of more than $5 to the taxpayers. And that's a result of reduced outlays for public assistance and people generating income tax, whereas before they were income tax users. So that's what we are currently doing. Is it scalable? I think one answer to the question is we are in 6 counties now, so the program is clearly replicable. I should tell you that Fresno has just completed a planning process that included McKinsey & Company and the Brookings Institute and Jobs for the Future. And one of the major initiatives coming out of that process, which led to a 10-year investment plan for Fresno County, was an initiative called the Upskilling Initiative, which is aimed at lifting 25,000 people to living wage jobs, and that 25,000 people actually translates into more than 70,000 residents, when you include family members. I think the third piece of that I want to just quickly reference, Jackie, is that one way to scale programs like that is through working with, in our case, community colleges. We just launched last year a program that is a partnership with the Chancellor's Office at the California Community College System and for community colleges in the San Joaquin Valley and in the Inland Empire, with the mission of enrolling CalFresh beneficiaries and getting at least 70% of those that we enroll to completion of a course of studies within 2 years. Now, it can be an associate degree or a certificate, a CT certificate, or a industry recognized credential. And just to give you a frame of reference, for those 4 community colleges, the average completion within 2 years is 13%. So this is a big, hairy, audacious goal, but one that we are confident we can achieve. And so the intention is to pilot that and then to try to expand it to the rest of the community college system.
Great, thank you. Let's talk about the cost of living. So, Richard, your program similarly is about hooking up families, children with wraparound services already in the community, but that all gets upended if people are forced out of their communities because it's just gotten too expensive. I'm wondering if you can talk to us about lessons you've learned about what is in the control of policymakers when it comes to slowing down or fighting displacement.
Wow. So I think, as has been mentioned, there's a whole host of supportive services that we can provide to families, whether it's EITC, helping them process their EITC so they have that extra income, connecting them to below market rate rentals. But what I've seen happening in San Francisco that I think is actually a lesson for a lot of communities is that the city has worked with local foundations to create what they call an accelerator fund, which allows affordable housing developers to identify existing apartment buildings that are rent controlled but are at risk of being purchased by speculators. And what this accelerator fund does is it allows affordable housing developers to compete with the private developers, and in terms of making offers in a very fast real estate market on these existing rent-controlled buildings. So our Promise neighborhood has bought 25 apartment buildings to date, and is keeping all those families in the neighborhood. So I think that there's just some innovative things that can be done around housing, around identifying and preserving naturally occurring affordable housing. So that's one thing.
Great, thank you. Now let's move on to the stagnating incomes piece of this whole equation. Today, having a job is far from enough to get people out of poverty in many cases, as Tess just showed us in these slides. In fact, PPIC's research shows that 45% of working poor people actually have full-time jobs, and another 21% work part-time but year-round. So we just passed the final deadline of the legislative session, as was mentioned previously, and our new governor, Governor Gavin Newsom, signed a total of 870 bills, I believe was the count, including a $215 billion budget. Caroline, what policies from this past legislative session would you expect to move the needles the most in terms of helping working poor people access higher wages?
Well, I was thinking about safety net programs and when the governor signed rather than higher wages. So
We can also open up that question to what would move the needle the most in terms of reducing poverty, which is a more comprehensive question here.
I think there's a number of things. So if we talk about higher wages, but we certainly expanded the Cal EITC in a pretty big way, and we've done that a number of times since it was begun in California in 2015, and now alongside the federal EITC, which brings in close to $7 billion to California working families every year. The Cal EITC is expected to bring in about $1 billion to families.
And can you explain to us how the EITC, what it stands for, and how it works?
Sure. So the Earned Income Tax Credit and how it relates to working families is that it's a tax credit that you receive when you file your taxes, and it depends on having earnings, and it depends on having sort of few assets and low either low wage work or overall low earnings during the year. You do need to be a citizen or have documentation status in order to qualify, and unfortunately, unlike many safety net programs, even if your children are eligible and the parents or one or more parents are not, you can't qualify, at least as of now. But otherwise, it is a pretty powerful, has shown to be, through research, a pretty powerful way of encouraging employment, and has shown to have some other good outcomes, like encouraging education and improving health outcomes. So it has multiple positive effects, and California has really made an investment in particularly expanding the EITC initially to families that are very low income, and over time adding some benefits for those who are making up to a full-time minimum wage throughout the year. And in this particular expansion, there's been the addition of a young child tax credit of up to $1,000 for families with at least any children under the age 6. And so that's really all combined, potentially very helpful for low-wage families. And so I think that's an important investment. But I also want to say that I'm a proponent of the idea of linking programs across, the different kinds of programs, because it's a complex and can be a fragmented safety net. And I think that one bill that was signed, AB 1377, that is trying to work with the programs that we have, CalWorks, Medi-Cal, and school meals in school districts, and overseen by the California Department of Education, to help bring CalFresh to more families, children who qualify for free school meals. I think that that's an important investment, and I think there's additional work that could be done to kind of make that nutrition safety net across the different programs that we have even more seamless. So CalFresh, school meals, also the WIC program, that if those dots, you connect those dots together, those programs together for children can make a really meaningful difference in poverty. So I think that I would highlight that, even though it's not directly related to increasing wages.
That was great, thank you. Richard, you are promoting the creation of a California Promise Neighborhoods model, and you've talked as well about the fragmented social safety net system and work that can be done in terms of integrating it better.
Yes.
I'm wondering what lessons you've learned from working in and on a promised neighborhood, and if you can sort of describe what that means to us. Would you apply to a state version of this program?
All right. So just so everybody's on the same page, Promise Neighborhoods were started by President Barack Obama back in 2012. He was inspired by something called the Harlem Children's Zone in New York. Education leader, Jeffrey Canada, made a promise that in his neighborhood, he believed that every kid could graduate and go to college, no matter how much money their parents made, no matter where they came from. as long as they had the right wraparound supports from cradle all the way to college. So he, through his initiative, provided kids starting from when they were babies and actually even at the prenatal level, preparing parents and babies to be able to make it all the way through the education system, succeed and go to college. And he was very successful in that. And he inspired Obama, and he created the Promised Neighborhoods across the country. There are now 6 Promised Neighborhoods federally funded in California. And what we've seen is that by providing these wraparound services, so working with preschools, working with clinics, and the whole gamut of other community agencies that are in communities, and sharing data, breaking through silos, holding ourselves accountable to common goals, we've seen that kinder readiness rates have gone up dramatically. We've seen test scores go up dramatically. We've seen graduation rates go up dramatically, and college enrollment rates in our neighborhood. It's a place-based strategy. These successes are being seen at Promised Neighborhoods across the state. We have actually put together some proposed legislation for the state to create additional Promised Neighborhoods, because we think this could be game-changing for low-income communities across the state. And if we did this on a wider scale, the collective impact could be pretty impressive. So we put together SB 686 in January of this year, and it made it all the way through the Senate, but is now in the Assembly. We think that a lot of the principles that we've been able to identify since 2012 in our Promised Neighborhoods, we've lifted those up so that they are kind of packaged and they're part of the state legislation, and we think that it can happen.
Peter, from your perspective as the founder of a program that is on the receiving end of federal investments as well to fight poverty, how should state or local governments be addressing how and where to invest funds into community organizations?
I'm the slow person on the panel. I'm still one question back. You asked me how we navigated stuff, so let me address that first, and then I'll come back to your current question.
Thank you.
So the way we run the program, the California Bridge Academies, is we're based on 10 principles. I'm not going to take you through 10 principles. I'm just going to focus on one that I think is absolutely critically important, is absolutely essential, and that is our mentorship model. We have case managers who are called career and family navigators. They're referred to by their clients as my CFN or my navigator. They essentially adopt their families for the 18-month duration of the program. They are there from the beginning. They actually start with very in-depth assessments of the head of households, aptitudes, experience, passions, so that we can make sure and align them to the right kind of training, education, employment, and so on and so forth. The second assessment is of the family and all the family barriers that they have, so we can address those as well. And that then we put together an individualized plan for each family. And the navigator is responsible for making sure that each client is connected to the right on-ramps. And let me just give you a little anecdotal information. When we started the Bridge Academy in 2010, we partnered with 12 different organizations who we knew provided services and were funded to provide services that were likely to be needed by our families. That was in 2010. In 2016, we referred people to 117 different organizations that delivered 165 different services. These are not just agencies, obviously, they're nonprofits, et cetera. So there's a lot, and by the way, of the 165 services, 164 of them had a source of funding. So there's lots of services out there, but navigating that maze requires a PhD. And so that's the responsibility, one of the responsibilities of our navigators is to make that whole process seamless for the families, so they don't have to worry about where do I find this, where do I find that, and so on and so forth. So I wanted to, make that comment. Let me now address your second question, one you just asked me, and that is, we are primarily today reliant on federal funding through the Cal First Employment and Training Program. And unfortunately, that funding is constrained. There's a source of funding that is 100%. All you have to do is apply for it as a county. It goes through the California Department of Social Services. California Department of Social Services allocates it based on the number of work registrants. There is a separate pot of money that's 50% funding. And some states take advantage of that. California does not. California does not match. And so we don't, take advantage of that. And it's essentially an uncapped amount of funding that is potentially available to California. And so that really limits the amount of funding that is available to us in California. If we could do something about that as a state, it would be great. Let me just add one more comment, and that is the governor has launched an initiative called Regions Rise Together, which is specifically aimed at lifting regions of the state that have been left behind. And if we could do something specifically aimed at disadvantaged people living in disadvantaged regions, we would do really well in terms of being able to lift those regions that have been left behind. Because we don't just have income inequality on an individual level, we have regional income inequality big time in the state.
Thank you. We've been talking about poverty despite a booming economy, but what happens when the economy turns south? Governor Gavin Newsom warned in early October that there may very well be a recession on the horizon. This question is for Caroline and then for Kim. What lessons should the state learn from the Great Recession about caring for those already in or vulnerable to falling into poverty?
Well, I very much hope that we don't experience another Great Recession the next time we experience a recession, but I do agree that it's likely to be coming. And I think that most safety net programs have multiple goals, and among them are short-term goals of supporting family income or resources, and then there are longer-term goals, achieving self-sufficiency, improving health outcomes, improving educational outcomes. And my sense is that the shorter-term goal during a recession is probably the goal that, and I think lessons learned from the last recession is that there was, I think, more attention paid to that shorter-term goal of supporting incomes and somewhat less attention paid to aspects of programs like work requirements that also cost money to provide necessary work supports and services like childcare or assistance in finding a job or maintaining employment. But maybe could take seconds, at least during the Great Recession, in part took second place to some extent, although there were also cuts to programs in terms of family benefits to maintaining income support during the time when families are turning to the safety net because poverty is rising and there's increased need.
I think a few things that we've learned, and I too hope the recession isn't nearly as great as it was. A few things that we've learned, I think, and are continuously improving to put into place. One is just around our data and our evidence and knowing what works and being able to be more focused and strategic when we know we have to make cuts where they have the least harm done to those that we're serving. I think there's a few different policy changes. Well, so on the data piece, I will just say that there are examples. I was mentioning the CalWorks program earlier, our cash assistance program, where we have, as a state, we have a federal outcome that we're expected to meet, which is work participation rates of those that are participating. We also have just taken, about 18 months or so with stakeholders and actual participants themselves to create a new set of measures by which we think measures success of making progress across a number of spectrums, whether they be related to employment or the child's well-being and those kinds of things. So we have really identified what we think and defined what we think makes make success, and we are tracking to those then across each county, across the state, and having opportunities for improvements, providing technical assistance to support areas where any particular county is having challenge. So really making sure we're tracking the right things in terms of the outcomes we're trying to see, but having data to inform that. In the Great Recession, that same program, we did made a number of policy changes that essentially exempted our participants from some of these requirements, right? So we have to think about, it's not, you can't find a job, right? You can't find a job in employment, right? So how can we change the policy with any given program to reflect what's real in terms of the relationship between the economic conditions and the program itself? How can we expect people to do something that's much harder to do in that kind of climate and context? So I think we have some lessons learned from that. The other thing I'd say is we also have taken a hard look at some of our funding methodologies for some of our safety net programs, and want to ensure they reflect the changing economic conditions. So for example, when we know more people will essentially come to the door for assistance and safety net during a recession, how are we both learning from how quickly counties can increase staff, but also at the same time, in times like today, where caseload is actually declining and falling, what is it that the core services and resources that need to support the function of the work need to maintain, and how are we really looking at the continuum of needs of who we're serving? So not everyone needs the intensive case management. Some are more readily employable, and that certainly changes with those kind of economic factors and conditions that occur. So I think we have certainly learned on both the data components and evidence of what's working, and I want to just emphasize Caroline's point about the multitude of benefits at any given program. Even though food assistance and CalFresh is the primary function there, we also know what other outcomes and indicators of success in terms of academic attainment and educational attainment and so forth. So our policy changes, our data, our outcomes, and then how we are expecting counties to be prepared for those influx and change of who's coming to their door.
Thank you. And speaking of the recession, as Tess showed us, the recovery has not been equal, and there has been a growing divide in the haves and the have-nots. Another element of that is distinctly racial. There are huge racial disparities in incomes among Californians, as well as in wealth. And in fact, disparities in wealth grow or are larger than income when you take into account home ownership, savings, assets. Richard, your organization works to help families in the mission build up their wealth. Wondering if you can walk us through some of the biggest challenges and opportunities there, and what could state lawmakers be doing to help low-income and people of color build up wealth across generations in California?
Yeah, and I actually want to start with the last question as well, because I think they're related. But if there is a recession, one of the things that I think the state could do is kind of learn, I think, from what Pete's program is doing and what the Promised Neighborhoods are doing, is that making the services more accessible and more coordinated at the level of place, at the level of neighborhood, providing an entryway, an easier entryway for those folks who need it the most. And so I would just offer that. These types of community-based initiatives are very just community-oriented, and they allow for easier coordination at the neighborhood level. And if they're tied to data, which the new models, which the models are very much tied to data, then I think they could be a resource, like a low-cost resource for the state in terms of doing more with less. The other thing that I wanted to say is I really liked what Kim had to say around also just kind of restructuring how we're spending our money, because we know that the juvenile justice, the juvenile criminal rate of crime is going down dramatically. And for example, in San Francisco, our juvenile hall is almost empty. right? So yet we're spending hundreds of thousands of dollars a year operating this thing. So it's, how do we restructure how we're spending money? Our CPS, our Child Protective Services caseloads are way down, yet we still have the same staffing that we've always had. So how do we restructure that and at the same time move more towards these prevention-based models like these community-based initiatives? So I'm excited about that conversation. I'm not excited for a recession like everybody else, but I am excited to think about how can we do things more efficiently, more effectively. And then in terms of building wealth, we're like Pete and I are running very much the same types of programs. We're 2-generation approaches. So we're working with families to stabilize them right now, to get them some housing, hopefully long-term housing, to get them to build up their credit scores, get jobs, and so on. But there's a longer term goal with what we're doing. We're doing the 2-generation approach. We're not only working with the parents, working with the kids to make sure that they actually graduate and go to college and start a career, not a job, so that they're able to stay in place in their communities and to contribute to our state. So I think that's our approach, is just taking that long-term 2-generation approach.
And I'm going to turn that question to Peter as well. What do you believe state lawmakers could or should be doing to help low-income and people of color build up wealth across generations in California?
Yeah, and I'm going to also relate this to the question of the recession that is coming, whether it's next year or the year after that. It's coming, trust me. Let me just share with you what our experience was during during the Great Recession. First of all, there were a lot more people looking for services, some of them looking for services who had never looked for services before. And they were clueless. They didn't know where to go, they didn't know where to start, and so on and so forth. Second, those that were in deep poverty got pushed further down, because now there was a population of people who had lost jobs, who were better qualified than the people who, were previously considered to be, in need. So if we're going to address those issues, we have to focus a lot more attention on upskilling people across the whole chain, because even during the Great Recession, certainly in our area, there were jobs that were going wanting because we didn't have people with the right set of skills. The second thing is, I completely agree with Richard and Kim. We've got to do a much better job of integrating the delivery of services. Now, I don't believe that in my lifetime that's going to happen from the top down, simply because of the way these programs are all structured. They're all developed by committees of the Congress or the legislature that have very narrow jurisdiction. They want to make sure that there's no duplication of effort and so on and so forth. And so they actually very consciously try to limit the scope of what is being done under a program. And so we call our program at the California Bridge Academies a family up program, as compared to an agency down program. We're used to delivering services on an agency down basis. These are the rules under which we have to operate. This is, you're eligible, you're not eligible. Every program has case managers. Some of the people that we've dealt with, we're dealing with 5, 6 different case managers. That's very inefficient and not very helpful to the people who are trying to navigate this maze of services. So we got to find some way at the local level, and this has to be done community by community, to bring all of this together and make it as seamless as possible for the people who need the services and make it as cost effective as possible. I've told you a little bit about what we do. Let me tell you that our cost per family over 18 months is $1,800. That's because we leverage everything that already exists. We don't duplicate anything that's already out there. So that's the kind of thing that I think we need to do, because during a recession, resources come down, service requirements go up, we got to spread the wealth, and that means being as cost effective as possible.
Thank you. I'm going to open it up to questions from the audience now. We have 15, 20 minutes. So please take advantage of having these experts here with us today.
Hey there, Sahara Hyatt with the California Homeless Youth Project. Thank you all so much for just emphasizing the key issue of housing on this panel. I'm sort of curious, so we know that it's such a systemic issue, this lack of affordable housing, but we see a lot of hostility from politicians, I think, on both sides of the aisle towards people experiencing homelessness, and sort of this idea that it's an individual failure and not like a systemic crisis, this lack of housing or a policy failure. And so I'm just curious from the panelists how we can do a better job of shifting the narrative from kind of individual to kind of our failures. And obviously this report is something that helps, but any other thoughts would be welcome. Thank you.
I'll just say that I do think that you're right. There are systemic pieces here, and even just to connect to Jackie's question around racial equity, right? When you think about who's homeless in California, there's significant disproportionality amongst populations, no matter where it's in San Francisco or another community across the state. And so I think we have to think about that systemically. What's happening? Where are those things occurring? I think a lot of the investments that have been made, particular to our department in housing and homelessness support, have primarily been population focused. So supporting reunification in families of foster youth or elderly who are part of the adult protective services. They've been focused on populations in terms of who we're servicing, but the evidence base of principles like housing first and thinking through really connecting individuals to housing regardless of other things that are happening, making sure the housing's stable, and then connecting to the other resources that any given individual may need, I think are absolutely becoming more of the expectation and the way in which we're approaching the work. But you're absolutely right that it's a systemic issue, and how it's certainly complex, and that there are many different factors that have to come together to really address it systemically. I just agree with you in that space. So I would just say that again, from our perspective with the social service connection, we think it's key and critical depending on the needs of that individual or family, but it's absolutely being tied and connected to the fuller array in terms of how we're approaching the issue. Where is it that we're also supporting, for example, we have a program that's supporting the disability community in housing, and how are we connecting to SSI and other benefits. So we are looking at it more holistically, and also thinking through what levers the state has, but then what else we can do, and lots of conversation with the governor's appointed a couple of commissions and councils to look more holistically at looking at the issue from that lens. So I think there's more to come for sure in the conversation.
I'll actually add kind of a flip side of it. At the same time that we're fighting against the paradigm that you're describing, we are seeing communities step up to help. And so, for example, in our Promise neighborhood, we work in 9 schools. One of those schools decided to open itself up as a homeless shelter when the school day is over. It becomes a homeless shelter for the families that actually attend that school. And it wasn't easy. There were certainly neighbors that were, opposed to it, right? But we could see at the community level that, that battle is happening, right? But there are more community members I'm seeing willing to step up and say, this is all of our problem, and we're going to help each other. So I just wanted to share that.
I just want to add that I think the homelessness issue and the housing cost issue are completely linked, and you suggested that in your question, that the lack of supply of housing is a huge component of the problem, and that it is an incredibly difficult issue to address, because Californians need to look at themselves in the mirror. On the one hand, we complain about the lack of housing and the high cost of housing, but yet you have in community after community after community, you have protests over, no, not in my neighborhood. You're not going to build here, And by the way, the governor's objective of 3.5 million housing units, which I strongly support, is an incredibly challenging objective to meet. For reasons that are really, really hard to combat, not the least of which is Californians' bipolar approach to that whole situation.
Jeff Tartagia, an advocate, doing the pit count here in Sacramento, observing several other things. I believe 3 out of 5 have some form of assistance going on. Does that translate into more than 20 million Californians, or do you have the number and the same thing where you consider of poverty the threshold? $20,000, $50,000, and California, you know, as being a high, we'll call it cost state, the percentages of, right now they just announced a 2% increase, and yet so many other, I'll call it bureaucracies, California is giving 3 and 5% increases for public service.
Okay, I was gonna appreciate the comment.
Hi. Since the housing market is so profit-driven, how can we improve housing affordability and the supply when housing, like affordable housing, like Section 8 housing is seen as undesirable, and the whole NIMBY protesting, not in my neighborhood sort of situation goes on across California? I know it was already mentioned a little bit, but is there any way to sort of connect communities and investors and public government services to convince people otherwise? Is there any effort behind that? I don't know if that makes sense.
Well, let me start with that. I'm going to put a different hat on. I co-chair California Forward. We've been grappling with this issue now for several years. We've, actually put together some pretty comprehensive strategies that require everybody to come to the table. Because, I mean, there's so many different stakeholder interests, here. It's really difficult to address this problem when it costs, Richard, what does it cost? About $700,000 a door to build an affordable unit in San Francisco? Mm-hmm. I mean, that's insane. Yeah, right. But that's what we're dealing with. I mean, it's so many difficult issues to contend with. There's a shortage of workers, skilled workers to do the work. That drives up labor costs. Lots of different issues. It's going to require, I hate to use this term, but the mother of all coalitions to really, bring this thing to the ground. And the reason I was so excited about the governor's, commitment to this is because without his leadership, it's not going to get done. Even with his leadership, it's got to be very, very tough to do. I wish I could, give you more.
There was also some legislation that the governor just signed, sponsored by David Chu from San Francisco, that would allow regions to raise taxes to pay for affordable housing. Kind of bypassing cities who don't want to do that, right? They don't want to raise their taxes. They don't want to build affordable housing. So this regional approach hopefully will be one step in that direction of the region saying, look, we're actually an interconnected economy, an interconnected community here. You do have to build more affordable housing in your city.
Yeah, and I'll just note that the investment in the budget in just this first year was over $1 billion just in looking at housing supports. I think the governor's absolutely trying to think about partnerships between the state and local jurisdictions and others. One of the councils I mentioned is actually it's looking at a regional homeless advisors group who's thinking about the issue from that angle and perspective. And so I think there'll be more coming out of that and other solutions. But there are certainly, between the governor's investment, the legislation that's been enacted this year, a significant progress in addressing some of the issues and barriers that we know, and we are going to be working on this issue for years to come. But there's certainly been some progress made and some significant prioritization of the issue by the administration.
And I'll just note that the LAO and others, but a series of reports from a few years ago, the legislative analyst had showed that it's been decades in the making, this problem, and so we're behind in paying attention to it. But
hi, James Lee. I just to move the discussion a little bit away from housing, which I know is the major driver of a lot of this discussion. I'm curious as to why CalFresh, with the work that's been done, there is still underperforming and underserving Californians, and if there are lessons there for some other programs that we hope to expand and roll out to a broader population.
Yeah, I would just say, again, I think you're speaking to the fact that there are more eligible families to reach. We just launched, in a long time in the making, CalFresh expansion for those that were SSI recipients, that we were one of the last states to change that policy. And so we have enrolled upwards of 300,000 new recipients on the program in just the last few months alone in that population due to that policy change. So tremendous kudos and appreciations to our county and community-based partners in doing that outreach and focused effort. I mean, I think that's, to my earlier point, I think that there are communities, at the same time that that's happening, and by the way, CalFresh's kind of percent of eligible enrolled, that's been improving while other states has been significantly declining. So we are making more progress than that is happening across other places in the country. But to my point earlier, I think, again, having intentional focused outreach, we are in fact seeing some of where California does have a few different programs that are state-only benefits where populations might not otherwise be eligible through the federal program. We are seeing some decline in those programs. So the point that I was making earlier was really thinking about the context of our larger immigrant integration strategies and utilizing trusted messengers to do the outreach. I think that's a big piece of this. For different populations that we're looking to outreach, we also facilitated a Food for All stakeholder group over this last year with our partners to think through what are some other strategies that we can be more focused around. Language access comes up a number of times in that particular group. They're just getting ready to finalize their recommendations to the administration from that report. But I think that's, from our perspective, we want to be thoughtful about who is eligible, isn't being served, and how we're then tailoring and customizing the outreach to those populations, again, recognizing the overall context of other things that are happening in some of these communities kind of in real time on the ground.
Can I just make a quick observation? First of all, I don't want my comments to be misunderstood, so let me make sure everybody understands that I am 100% supportive of safety net programs. We at Bridge Academy, we make sure that everybody that's enrolled is taking advantage of every possible service which they are eligible. Even after they leave, we'll make sure that if they are eligible, that they're enrolled in the EITC and so on and so forth. Having said that, we have one of the highest take-up rates for CalFresh benefits in the state of California. We have the second highest poverty rate in the state of California. So just safety net programs alone are not going to get us to where we want to go. We have got to lift people up to where they are truly beyond poverty. And so that's the principal focus of what we do.
And we're going to do one more question.
Hi, this specifically, I guess, for Richard. You had mentioned earlier in your presentation about something about accelerator fund, something to basically, if you could say a little bit more about that, about what that is and where that funding is coming from and how that works, because of course, we're talking about the need for more housing, but every unit that we lose of the existing stock makes that problem even worse. So.
Yeah, it's a fund that allows affordable housing developers to buy available property in place of a market rate developer purchasing it. And it's called Accelerator because it allows them to move quickly. It's a lot of money up front you got to put a lot of money down in this market. And so the money comes from two sources: developer fees. So advocates went to the city and said, hey, the developers have to pay some sort of fee to develop in San Francisco because they're raising the cost of living, they're creating all this displacement. So the advocates advocated for developer fees. Those developer fees can go into building new affordable buildings. They can also go into helping to purchase these existing smaller apartment buildings in combination with funds from foundations. So that's the Accelerator Fund, and it's been very successful. And it makes a lot of sense because you don't have to wait 4 years for a new building to get built, right? There's a building that has working class or low income people working in it, and I mean living in it, and you just, as an affordable housing developer, you buy that building before a speculator gets it, and then you just lock in the affordability.
Do we have time for one last question, or is that the end? Okay. Thank you all for being here. Let's give a big round of applause to our expert panel. And a big round of applause for our audience for being here today. I appreciate you all.
We should catch up sometime.